All right, welcome aboard. It is time for the creative spending strategies for small businesses. We are super excited that you are joining with us today. We're going to give just a couple of minutes for folks to climb aboard the show. It always takes a few. If you guys have never done one of these before, a little insight. There's a lag behind it. So it's kind of interesting, but a lot of times what you're seeing happened 10 to 15 seconds ago. So it's kind of an interesting thing on our side, uh, learning about that as time goes by. But I think we're going to have a very interesting and educational show for you today. I met Mr. Tim Urich here a few months ago when he was a guest on my Health and Wealth Power Hour podcast. It was very, very interesting to me to listen to some of the strategies that he had for small businesses. We noticed that a lot of the things that we do, we have in common, as in we have that heart for small businesses. We really want them to succeed. And so many times, the reason that a small business doesn't succeed is financial. Uh, you can say, well, that's every single time. It's not always. There can be other reasons, health issues, different things that can come into play that make small businesses fail. But yeah, I would say the majority of reasons is financial. But a lot of times it's not just because people don't understand business, it's because they don't understand money. And they look at traditional ways of spending and think that that's the way it has to be done. Well, we're going to show you some very creative ways today to really take control of your cash flow. That's the biggest part. In fact, Tim has his own podcast that I was a guest on, and that's exactly what it is. It's about controlling your cash. So, very interesting dynamic that we had in being guest on one another's podcast, and we felt like it would be extremely beneficial if we co-hosted an event together and really put some true strategies out there, something you can actually take to the bank. Actually, something you can do today. You don't have to wait on these strategies. These are things you can start implementing today. So we are super glad to be here with you today. One of the things that we want to do is bring these strategies to you. I am now going to turn the stage over to Mr. Tim Urich. He is the founder of Tier One. They really have some innovative things. You guys are going to, man, I'm so excited for you to be part of this because I think you are just going to absolutely love what Tim is going to show you. So I'm going to turn it over to Tim now.
Well, thank you, Harlan. And it is such a pleasure to be here and to share this stage with you because, as you said, cash flow is probably the number one reason why businesses fail or why businesses struggle. And we've done a lot of research and came up with some reasons why all of that happens. And unfortunately, what we found is that a lot of it is self-inflicted. But as a small business owner, we're juggling a lot of balls. We're taking on a lot of tasks and jobs just to get by and to serve our clients, provide a good income and a good lifestyle for our employees, as well as ourselves and our families. But imagine your life with unlimited cash flow. Today, you're going to discover the 5 areas where you can be giving up control of your cash flow unknowingly and unnecessarily. Now, unknowingly means that you don't realize it, and unnecessarily means that it could be fixed. You could actually stop doing those things. You're going to learn why 61% of businesses, according to Intuit, 61% of businesses struggle with cash flow issues. You're also going to learn that it's not what you buy, it's how you pay for it that really matters. We call that the how is the financial golf swing. And you're going to learn about our 4-step process that will allow you to regain control of your cash flow. Because the reality is this: whoever controls your cash flow controls your business and controls your life. Now, nobody wants to worry about money, but the reality is every move we make with our money is either moving us forward or holding us back. And the fact of the matter is that many of the things that we think should or are moving us forward are actually preventing us from reaching our full financial potential. Now, what if what you thought to be true turned out not to be true? When would you want to know? Well, most people tell us they would want to know immediately. And here's an interesting piece of data. The average U.S. household owes more than $165,000 of debt, according to a NerdWallet study. And the point is that now more than ever, we need to be in control of our money. Why? Well, the good news is that we're making more money. We're usually, for the most part, our incomes have gone up over the past 4 or 5 years. But here's the bad news. Inflation is up 18.6% since 2020. And what that means is that something that cost $100 in 2020 now costs about $119. The average savings rate is now down to 3.2%, which is 38% lower than it was a year ago at 5.2%. And what we're finding, the data tells us that money troubles are keeping us awake. 77% of Americans feel anxiety about finances, and 58% feel that their finances are out of control, according to Capital One. Now, here's the irony. Again, in my 39 years of experience of working with business owners, I found that most of these money and cash flow issues are actually self-inflicted. Let me repeat that. It's self-inflicted. Why? Because of the way we've been trained, and I say trained, to use our money. It's preventing us from realizing our true financial potential. Now, how do we get trained? Well, we get trained by the large vendors and the companies that we deal with. We get trained by the financial institutions, the banks, the investment firms, the insurance companies, and we get trained by the government to use our money in a way that is beneficial to them and detrimental to us. We call that the financial golf swing. And in financial services, the products that you own, they're analogous to the golf club. And all financial institutions, they manufacture financial products. Again, we're going to call them the golf clubs. And they market them in a way that indicates to us that our financial success is predicated on owning the best products. Nothing could be further from the truth. The fact of the matter is your financial success is predicated on how you're using your money. We call that the financial golf swing. So what we have done is we have set up a 4-step process. And the process is really simple. The first step is we identify exactly where you're giving up control of your money. And here's how our approach differs from other financial people. Other financial folks basically say, show us what you got. Everything you have stinks. My stuff is the best. And it's basically saying, show me your golf clubs, your financial golf clubs. Your golf clubs stink. Come to my pro shop. I'll sell you another set of golf clubs. And our approach is really different to this extent. We can't make a recommendation unless we see how you're using your money. So our approach is to say, show us how you're using your money. And we find that out through questioning. We ask you certain questions, and those answers to those questions indicate your financial golf swing. So our approach is to, before we make a recommendation, we take you down to the practice range, watch you hit a few balls, see how you're swinging the club and or using your money, and then we make recommendations. But it's a 4-step process. Number one, we identify exactly where you're giving up control of your money. Number two is the hardest step in the process. You've literally got to stop doing what you've been doing that you think is moving you forward. But again, if what you thought to be true turned out not to be true, when would you want to know? So the second step is the hardest. You got to stop doing what you've been doing for years. The third step is to save your money or redirect your money to an account that you own and control. And think of it this way. Right now, maybe where you're keeping your money, from an analogy perspective, is in your left pocket. And in your left pocket, everybody and their brother is going to want to get in there. Financial institutions, large corporations, advisors we're working with, everybody, the government, everybody wants to get into that pocket. If you take that money out, redirect it to your right pocket, and then we design that pocket so that the only ones that can get into that pocket are you, your family, and your business. Now, if you knew that there was a way to design a pocket that way, how much of your cash flow would you want going in there? So the third step is to redirect money into an entity that you own and control and that only you, your family, and your business could get into. And then the fourth step is, we always say, is where the magic happens. When that pool of money or that pocket gets large enough, you can utilize that to borrow against your own money and pay interest back to that entity that you own and control. And if you step back and think about what's happening here, your money never leaves your control, even while you're using it. So that's our 4-step process. And again, we're going to look at, there's 5 major areas where you could be giving up control of your money unknowingly and unnecessarily. Taxes, how you pay for real estate, how you're funding your retirement, how you're paying for your children's college education, and finally, and probably most importantly, how you're making major capital purchases. That's the 5 areas where you can be giving up control of your money. So we do a deep dive into all of those areas. So let's take a look at what we said we were going to do and what we've actually done. We talked about the 5 areas where you're giving up control of your cash flow unknowingly and unnecessarily. We talked about why 61% of business owners struggle with cash flow issues, and it's self-inflicted. What we haven't talked about yet, and I'm going to show you in a minute, is it's not what you buy, it's how you pay for it that really matters. And we talked about the 4-step process that will allow you to regain control of your cash flow. Again, because it's not, whoever controls your cash flow controls your life. So what we always say is the products are not as important as the process of how you're using your money. And before you make any capital outlay, you have to consider not only the cost, but the opportunity cost, because it's not what you pay for, it's how you pay for it. So most people think there's only 2 ways to buy something. You could either finance or pay cash. So let's use an example of buying a car that costs $30,000, and we're going to finance that car at 5% for 5 years. Now here's the deal. At the end of that time period, we're going to pay $3,968 of interest. And we see that amount of interest because when we go to buy the car, the loan form tells us exactly how much interest we're going to pay. And because we see that interest, we obsess over it and we say we don't want to do it. We're not going to pay interest. I'm not paying $34,000 for a $30,000 car. So what's our solution? Our solution is to pay cash. Well, first and foremost, we need to have had built up our cash position in order to have that, which is not easy in today's world. Secondly, if we could have earned 5% interest on that money, what we're actually giving up is $8,501 of interest. So think about this. We didn't want to pay $4,000 of interest because we saw the interest that we were going to pay on the loan form, but we never see the interest we're going to give up. And we're actually giving up $8,501. We're giving up more than twice as much interest if we pay cash. Now, the question is, why is that? Well, it's real simple. When our money is saved and it's compounding, it compounds on an increasing balance. And when we're paying down a loan, every payment includes principal and interest. And the principal lowers every month. And consequently, we're paying down that loan on a declining balance. So we're amortizing on a declining balance. We're compounding on an increasing balance. That's why we earn more interest. Now, if you know this going in, the decisions you can make with your money can keep you in control of your money rather than the banks, the credit companies, and our vendors. So hopefully that makes sense. So we talked about all of those issues today, and I'm going to turn it over to Harlan.
All right. Hey, Tim, that was outstanding information. We do have a question for you here from Thomas Bransky. He wants to know, is your plan harder to function with than what most of us are doing?
Actually, it's simpler. And here's why. When you're looking at things through the lens of being in control, all of your decisions you're making with much greater clarity, because it's simple. Should I do it this way? Well, if I do it this way, I'm giving up control of cash flow or cash. If I do it this way, I'm in control of my cash flow and my cash. Think of the cash flow as financial energy that's it's either moving away from you or coming back to you. So Thomas, if the decisions are really simple to the extent that whenever that cash flow is coming back to you, you know you're making the right decision. So the fact of the matter is, it's simpler. It's just different.
Yeah, but it's interesting. You mentioned earlier what the biggest issue is for most is it's different. You said that in a different way earlier, but that's what the biggest holdup is, right? It's different. And the reason most people don't know about it is because no one wants you to know about it, because all the folks have their hands in your pockets. They want that to be there. Okay, so Thomas has a follow-up. He says he's asking from an ease of use standpoint. So I am moving money from one account to another often to be able to use a debit card to pay for things. So that is, I guess this is what he's talking about. The ease of use, the access to money. Maybe, Thomas, is what you're really asking is how easy is it to access that money? Because right now what he's doing is moving money from one account to another to be able to use a debit card.
Yeah, and so the answer is there's basically about a 3-day lag period. But the fact of the matter is, the way we set this up, typically when you're going to use money or borrow money, you're asking permission and seeking approval. And in this scenario, you're actually giving an order to get access to your money. So hopefully that answers that question for him.
Okay. Thomas, if that you need a little more clarity than what Tim has provided there, then I'm absolutely 100% sure that he'd be happy to talk to you more in depth this
Yeah, in fact, there's the QR code here on the screen. You could access that and jump on my calendar, and I'll be more than happy to explain that to you, Thomas.
Yeah, and just so you know, Tim, and I know you had a really nice slideshow, but it didn't ever show up. So,
oh,
but I will tell you that the great thing of it is listening to what you talked about. Actually, I believe is a little more powerful the way that you presented it. So, in my opinion, having seen it a couple of different ways, I think the way that it came across today was actually very informational. And we'll do another thing, and that is people that want to. Yes, Thomas, we know there's no QR code at the end of my presentation. Thomas, will be Tim's contact information, including his email address, his phone number. All of that will be presented in just a couple of minutes on the last screen. So just stay with us there, Thomas, and we'll be happy to get that information to you.
What do they say? The best laid plans of mice and men, right?
Absolutely. Hey, good thing we got on early to make sure all the technological things worked, right? All right, great. Yes. So Olivia did also share in the comments there, Thomas. So you should be able to see in the comments where you can also go to set up an appointment with Tim. All right. Thank you so much, Tim. I am going to sit you off the stage for a few minutes while I go and share some information with some small business owners myself. And then I'm going to bring you back up on for any following comments or any questions that folks have. Once again, my name is Harlan Pickett. I am the president of Eagle Care Health Solutions. We are actually a consulting firm that helps small businesses have access to health care. Now, there is a difference, folks, between health care and health insurance, and we focus on health care. So that is exactly what I'm going to talk about today, is what that looks like for a small business when, just as Tim talked about, you make different decisions and say, you know what, why don't I take control of my health care? Why don't I take control of what my employees have access to? Because the numbers are pretty startling when you look at what is going on with the healthcare scene. 70% of Americans, according to a Harris poll, 70% of Americans believe the U.S. healthcare system has failed them in some way. I also do another show every month called Why Does Healthcare Suck? I got the idea by seeing this poll. Think about that. If 70% of us believe that the healthcare system has failed us, we really have no other conclusion to come to than healthcare sucks. And the interesting part is not all of it does, but that is your perception is your reality. Now, this is another thing that many business owners don't realize, and that is 70% of workers would be willing to switch jobs for better benefits. As a small business owner, it becomes very, very difficult these days, especially in the crazy thing that's going on in our country now with the way people don't want to work or they want benefits. They're going to switch jobs just for better benefits. Even more important to them than higher pay. And the last number I think is very startling too, and that is 61% of workers would take a job with a lower salary just to have better benefits. Now, how do you achieve that? And why does it even matter? And what are some of the simple steps that you can take, both for yourself as the employer, small business owner, and for your employees? Well, I think it's going to be kind of surprising to you what my recommendations are. The first thing we're going to talk about is preventative care emphasis. So why preventative care is important, how you're going to get that, and in a very cost-controlled way can be through direct primary care. We're also going to talk about health reimbursement arrangements. We're going to talk about understanding your benefits and why that is vitally important. We're also going to review and optimize our plan designs. Why? If you don't make the changes that are necessary and listen to what your employees are wanting, then your benefits aren't really benefits. And then, of course, I'll give you some final tips and takeaways. So the importance of preventative care is very easy to see whenever you look at it. Once again, that 70%. Why does 70% of Americans not like our healthcare system? Well, Another number in that study said that 61% of Americans only go to the doctor when they're sick. If that's the case, that means they're not getting the preventative care they really should. In most other, well, practically the numbers saying all other, what's considered wealthy country or first world countries, preventative care is highly emphasized. So what we see in those countries is lower cost for healthcare and greater life expectancy. The crazy numbers about United States is that we spend well over twice as much as the next country on healthcare, but we have one of the worst for first world countries. We have one of the worst life expectancies. So the numbers certainly don't compute. The numbers of what we're spending don't get us a life expectancy we should expect. Part of that is because there is no emphasis on preventative care. That is one of the worst paid from Medicare and Medicaid, and it seems to go down every single year. There is very little through medical school. There's not a lot of reasons why people would want to do it, because whenever they see what the cost is, and in a traditional model, preventative care, primary care, a lot of what happens there is those folks are very overworked and they're not paid. They're not compensated in a very well. It's a tough gig, in other words. But if you find the right way to access preventative care, it can make a huge difference. You can get the early detection of health issues, a reduced need for expensive treatments, and improved long-term health outcomes. Think of how important that would be to you as a business owner and also to your employees. You're going to have less turnover because they're healthier. You're going to have less absenteeism because they're healthier. And you're going to have people that last with you longer into their careers because they have improved long-term health. So it can be a really, really big deal. Now, the question then is, how do I get that affordably? Well, there is a model out there called direct primary care. Now, while it may sound to some of you like something you've heard of called concierge medicine, it is not the same. First of all, concierge medicine in most cases is pretty expensive. People also call it executive care. Well, in this direct primary care model, it is a very affordable set monthly price for unlimited access to preventative and chronic care. In some of the cases, they also include urgent care. But the focus from direct primary care is going to be on preventative care and chronic disease management. And I've heard so many people tell me that I have diabetes. We hear it all the time. And unfortunately, most doctors in the traditional setting will tell you this is something we're going to have to treat for your entire life. A direct primary care doctor is going to show you ways that you can stop taking insulin, that you can get off of the medications. They're going to work on your lifestyle. They're going to help you really overcome these chronic diseases. They're going to help you manage them, but they're also going to look for a way to stop utilizing medications and other ways, because there really is a way in a lot of cases for some of these chronic illnesses to get away from those medications. That's not going to be first on their list. Let's put you on a medication. They're going to help you in many other ways. Now, this becomes very cost effective, and because it is a flat monthly fee for unlimited services. Therefore, you got predictable costs. That's very important to a small business. Those of you out there that are running your businesses, know folks that are running their businesses, there is almost nothing more important than knowing what your predictable month-to-month cost and spend is going to be, because how else are you going to run your business? And many times people don't have benefits because they don't have predictable costs, or because benefits are simply too expensive. This is a way where you can set a certain amount and know what it's going to be month in, month out. Another way that you can also do that, but have more flexibility for your employees, is through a health reimbursement arrangement or an HRA. What this does is it allows you to have an account where you reimburse medical expenses. You can set aside a monthly amount, and you can reimburse employees for their medical expenses. This, once again, helps you control costs because you know exactly how much potentially could go out in any single month. This provides tax advantages to you as an employer and also to the employee. So this is a very popular way to structure a benefit for someone when they are, you don't know exactly what you want them to have. You kind of give them some options. They can also use this for, let's say, co-pays or deductibles if they're, say, on a spouse's plan. So maybe they don't even need health insurance necessarily from you, but they do want some extra benefits. They can use some of the money from the HRA to pay for that as well. And so the flexibility in covering a range of expenses really makes this a very popular option. Now, why does understanding your benefits matter? Let's say that you're a small employer and you said, you know what? The only way we're going to be competitive in this market is to have some benefits. So you go out, you get some quotes, you decide, man, all this is too expensive, but we got to have something. So you go ahead and you jump in to a plan. And now you were just told, this is it. This is going to be the best option for you. Whoever the broker or agent you had talking to you just put you on whatever it was that you could afford. Unfortunately, we see that all the time. It's whatever it is that you could afford. Now, one of the problems that we see, of course, a lot of times is then poor participation because it may still be too expensive for the employees if you're paying, say, 50%, or maybe you're not even paying that much. But you're then not maximizing the value of your health plan because you've went with a traditional model. Remember, what Tim talked about on the financial side can be the same on the health side. If you don't do something different because you're going to do the same old, then you're likely to get the exact same results. And you're very unlikely to maximize the value of your health plan because a health plan can really take on very different shapes. Okay, you want to ensure that your plan gives access to the appropriate care when needed. That's not always possible when you don't understand your benefits. Okay, you also want to reduce the overall health care cost. Once again, if you don't understand your benefits and what is in your benefits and the value of your benefits, you're not going to be able to achieve that. And when you do understand these things, you're going to have improved health outcomes, just like you will in preventative care. If you have a plan that you worked with your consultant or your advisor on to make sure that it fit the needs of your business and your employees, by getting input from them, you're going to have a plan that everyone is happy with and will improve health outcomes. All right, but how do you get there? Because you've got to start somewhere, right? Well, you've got to put a plan in place, but the only way that you can tell if that plan is doing what you wanted it to do is to assess the plan performance and, of course, the employee satisfaction on a regular basis. This cannot be every year you get to the end of it and you say, well, let's see how it worked this year. That's not the right way to do that. You've got to really take a look and see how the plan is performing throughout the year. You look at the plan, you look at the satisfaction of the employees, and then you make changes as necessary. One thing that you can certainly do is offer a customizable benefit package to meet the needs of your employees. These are not as easy to put together. They're not off the shelf. And so that's why many people do not offer them, is because they don't want to do the extra work. As a consulting firm, we're going to show you options. We're going to tell you about options. Even if we're not your broker or advisor, we're certainly going to let you know about what's out there so that you can make the best decision for your company. We're going to identify gaps and unnecessary benefits and adjust what's needed. Can you imagine offering benefits, paying for benefits for your employees that no one uses? Talk about wasted monthly funds. There they go. They're going out the door and no one cares about them. And if you don't take this last step, you never know. You've got to conduct employee surveys and gather feedback. You've got to know what people like and what they don't like and what they want before you can do anything else, before there's any benefit to you whatsoever. Interesting, little side note on this. One of the up and coming, everybody wants it, benefits in the last 2 to 3 years is pet insurance. Pet insurance, pet insurance, pet insurance. Everyone's yelling that they want pet insurance. But when the numbers finally came out to show how many people were actually signing up for the pet insurance, they were startlingly low. So there was all this screaming about pet insurance, but it was from a very small percentage of the employees across the board. And at the end of the day, a very small percentage we're then participating in that. That doesn't mean pet insurance is bad. It just means listening to a small percentage of people ask for a benefit. And once again, in most cases, this didn't cost the employer anything, but you have to watch what you're doing. If it is, pet insurance is not an example where it's costing you more money, but it is an example where a small group screaming for something that you put in place, you could do that with other benefits that do cost you money. And without looking at the numbers, it's going to be very difficult to find out if it was really a benefit or not. So one of these are really what I want you to remember. If you can utilize your cost-saving healthcare strategies, you can attract and retain quality employees in a much better way in this very difficult environment that we find ourselves in today. If you work with a benefits consultant to review and optimize your offerings, you're more likely to achieve all the goals that you're setting. You should have a certain goal. If you have never thought about this, what are the goals you hope to achieve with your healthcare spend? There should be goals there. If there's not, you should be talking to a business consultant, such as we are at Eagle Care, to really dive into that and figure out, what are my goals? What am I looking to do with my healthcare spend? Make the maximum amount of that. And then you cannot implement a benefit strategy without looking at what is going on in it. You've got to have some data-driven insights of both how the plan is working, how you look at it, and how your employees look at it. Because the numbers show that in many cases, HR believe a plan is working very well, where the employees are very dissatisfied with it. So a very interesting dynamic we see whenever we look at the numbers from employers, as far as how an employer, HR, or management sees the plan working versus how the employees see the plan working. So that is the final slide of mine. And this, of course, is our information. I'm going to bring Tim back up on the stage as well. If I can find him. There he is. All right. So let's go.
Harlan, just a couple notes here. One of the things that struck me as you and I have been talking over the past several months, is that what people don't realize, or business owners don't realize, is that there are more options than what the traditional or conventional insurance broker is providing them. And ultimately, the success or failure of your healthcare plan really revolves around the perceived benefit or value that your employees are receiving. You could be providing a benefit, and if they're not seeing the value or utilizing the plan or getting benefit from the plan, then to your point, it is wasted money, and that money's just leaving you every month.
Yeah, absolutely. A lot of folks think the answer is just get a traditional health insurance plan, right? That'll make everyone hush up. That'll make everyone wants me to get some type of benefit. So let me go and get a Blue Cross plan or United Healthcare plan or whatever it is. It doesn't make any difference. But I want to make sure that there's a name on the card that someone recognizes. Well, that's very nice that you've done that. But without understanding how the plan works and what you've really purchased, are you really offering them a benefit, or are you, and this is a real deal, when you offer that plan, sometimes you're interrupting healthcare they were already receiving in a different way, and now they cannot access that healthcare anymore because you're offering a plan. And a lot of times employers don't even understand that because they've never really taken the pulse of the employees. And I can't tell you how many times I have heard from someone, well, I've got to get a plan in place, and we've got 5 employees, but I have one. I have one employee that says she's going to leave if I don't get a health plan. So I'm going to go ahead and get one. Well, what they do is they get a plan for that one employee, but they have to offer it to everyone else. And that's fine. There's nothing wrong with that. The problem is when they do that, let's just say that one or two of those other employees are getting a plan from the marketplace. Well, now that a plan is being offered at work, they may no longer be eligible for a plan on the marketplace. And so by giving a plan to one, they've taken away from 2 others. There are other things that you can put in place that would not have that same effect. you can do something to help that person so that they get to stay without running off some other ones or affecting their health care. So yeah, there are so many ways that you can design a plan. And what you're typically not asked as the employer, and you should be by everyone that's offering you something, is, well, what do you want your plan to look like? What do you want from your plan? What's important to you? How do you want to use your healthcare spend? That's the important part, and the questions that are missed. Typically, you just have someone say, I need a health insurance plan. Can you help me? And the broker says, yeah. Which one you want? Blue Cross, Aetna? You know, who you want in there? We'll get you whoever you want. So that's the big difference there. Okay, so we do have a question here. So Angela Dula wants to make a comment on how AIM is another step towards saving money and offering quality care. Okay, so Angela, you should have in Messenger, you should have a link where you can jump up onto the stage. So look for that in Messenger, Angela. I guess whichever platform that you're on, because we are across multiple platforms here today. And yeah, I'll give a little preface to what Angela is going to talk about. So when you have a plan that you have built for you, one of the things that you should have that most health plans, traditional health plans, don't have is any way to measure quality, to make sure that the physicians that you're seeing are not just in network, but they're actually quality physicians. In some cases, we don't even use a network because all we want you to do is go to quality physicians. As we talked about direct primary care earlier, that's not necessarily a network, right? You're going to a practice. Sometimes they do have multiple locations, but you're going to a practice to receive those benefits. But AIM, Alt International Medical Management, is a company that does provide navigation for that. Okay, looks like Angela is going to be able to come up here. There you are. How are you doing today, Angela?
Hi, I am great. Thank you. That took just a second to get in here.
Yeah, absolutely. Yes.
I
these new platforms, we're all learning, Angela. We're all learning on these things.
Absolutely. And I won't take but just a moment, but I am with Alt International Medical Management. I'm the business growth and development specialist. And what Harlan and Tim have said is spot on. There is one step further that can help groups to save money, and that's by using a medical management firm. The medical management firm that uses utilization management to help guide the patients to the best quality health care. Typically, the best quality health care is going to be less expensive. It's going to save money. Now, if the group is paying anything more than $6,000 PEPY in their claims, that's health and pharmacy combined allowed, then AIM can definitely make a difference for them. A medical management firm that guides patients to the best quality care, that is handling the pre-certification, and that is using utilization management is going to save that group money. So that's something to keep in mind as well. To include that in your health plan makes a huge difference. You can add a lot of cost containment, other providers, and you do really well. But when you add that medical management component, that's where the largest savings can come in.
Yeah, absolutely. Thank you so much for those comments, Angela. And remember, folks, this is all part of a strategy. What we're talking about today is strategies to help you control your cost as a small business. And I will tell you from experience, and this is unbelievable, I know, but healthcare doesn't work like everything else. And most folks don't realize that when you hear the old saying, you get what you pay for, it doesn't apply to healthcare. It just doesn't. And it doesn't make sense. You would think if I pay a whole lot more, I'm going to get so much better care. But that is just not the case. it should be, right? I mean, I would actually like to pay a doctor that has better outcomes more. Wouldn't you rather pay a doctor that is an excellent, hardworking, great outcome doctor more? But the system doesn't work that way. It's crazy that it's actually inverse. In most cases, paying less gets you higher quality, and a lot of that is administration. So there's one of the biggest things that people don't understand is you look at how much money we spend on healthcare, and it's crazy. In 2023, $4.5 trillion was spent on healthcare, and about 25% of that was just on administration. So no one got anything out of that, right? No one got a single bit of healthcare on 25% of that. So over $1 trillion was just spent on that. That's crazy. That's just crazy. But this is what Angela's really talking about is if you take that piece out, if you actually have medical utilization management, so people are getting the right care at the right time at the right place, it changes the game. And so when you are allowing a health plan to be built for you instead of something that's off the shelf, it changes everything. And it changes your control. And now you know exactly what your healthcare spend looks like. And you just can't get much happier employees than knowing that they're going to be taken care of, because a lot of times it's zero out of pocket for them because of the way the plan is designed. It's not costing them a penny. They'll get quality healthcare. So, Angela, I really appreciate you bringing that. Do you have any last comments you'd like to make?
Just that, if I can be of any help to anybody, I'm certainly happy to do that.
All right. Thank you so much. And Angela, if you want to put in the comments, you can put your contact information in the comments as well if somebody would like to reach out to Angela.
I will certainly do that. Thank you. Thanks, guys.
All right. Okay, so folks, there on the screen, you can see Tim's contact information. He is the founder of Tier 1 Capital. I know he would love to talk to you personally. And of course, I would over at Eagle Care as well if you have any questions on our side of things. We are going to leave it open for questions for just a couple more minutes. Or if someone would like to come up on stage, such as Angela did, be sure and post a comment. And then my lovely wife, Kelly, will send you a message and you can jump up on stage with us. Love to see your smiling face and hear your comments if that's what you want to do. I'm going to turn it back over to Tim for just a minute to give any closing thoughts that he might have.
Well, thanks, Harlan. So I think the big takeaway here is there are options on healthcare that are, again, outside the box, so to speak. And there are options on how you're using your spending strategies and how you're using your money that are just slightly outside the box. They're different, but ultimately they put you in control. And that's really the point here. As business owners, there are so many areas where we are completely out of control. The Great Resignation, it's very, very difficult. That's a real thing. It's very difficult to attract, retain, and reward our employees. Almost every employer I speak with, Harlan, and I'm sure you're in the same boat, they would be, you ask them how things are going. It'd be great if I could, find 3 or 4 more technicians or 2 more salesmen or, another rep or something. Everybody's hurting to staff, they're understaffed. Right. And the good news is they're doing more with less, but they know and realize they can do so much more. So you have that issue going on. You have the cash flow issue going on. You have the healthcare issue going on. But really the point is this: in all of these areas, we're out of control. But really what this presentation is offering people is another way to look at things and another way to actually regain control.
Yeah, absolutely. And you said that very well, because this really today is all about your spending strategies. A lot of times it's things you're spending money on already, or it's things you've considered spending money on, but you haven't taken action because you knew that you were going to lose control of whatever those funds were. So I hope that we have given you some ideas today on how to regain that control or how to maintain control. Maybe you've done a really good job of maintaining control, but it's because you haven't done anything. Because when it came time to make a purchase, you just said, no, I'm just not going to do it. Like Tim said, you looked at that and you said, you know what? I ain't paying that interest. I'm not going to do that. So I'm just going to hold on to these funds, and I'm going to eventually build up enough money to buy that new whatever it is. But because life keeps going on, and especially because of inflation these days, you're not saving what you wanted to get whatever that new equipment was, because you keep spending more and more on the day-to-day needs that you have. And it's just a violent cycle that goes over and over and over, and you just can't get ahead. Well, there are strategies to work with that. You know, you mentioned how many times people just need extra employees, but how many times have we seen small businesses, you're in electricians, your plumbers, your AC folks, your all of those in that realm, where you've got this great mom and pop business that brings in these youngsters from high school, or, you know, maybe they went to some type of trade school. They come in, they're doing a great job. 5 years into their employment, all of a sudden they decide that they're going to start a family, and they've got to leave to go to a bigger competitor because that competitor offers benefits. And now you've lost out. You've trained them the right way to do things. And I'll tell you, that big company, they appreciate it. They appreciate the work you've done in training them up, but all the expense that you put into that. And even though that individual may not have wanted to leave, they don't see that they can afford not to, because while they may not be getting paid more going somewhere else, they're getting benefits. And these type strategies where you all of a sudden become the hero because of what you're offering, that's real. That's real because it's real to your employees. And that's what can make the difference in attracting and retaining employees. Also, as you mentioned, the last part that I missed, but you caught, Tim, rewarding them as well. I mean, that is just as important, rewarding them and keeping them on. So we really do appreciate you being here today. I'm not seeing any more questions. Tim, I'm going to give you one last opportunity to go ahead and vocalize how people can get in touch with you as well, sir.
Yeah, I could be contacted at www.tier1capital.com, and that's TIER, the digit 1, CAPITA as in alpha, L.com. And if you have any questions, we'd be more than happy to spend some time in answering those questions and giving you some clarity.
All right, great. Thank you so much. If for some reason you came in late and you want to watch the whole show, well, immediately after it's over, it's going to start rerunning. So you will be able to watch the whole show on whichever platform that you actually are on right now. You should be able to access that once it's over. Once again, you can watch it all the way from the beginning. If you have any questions for us, please reach out to either one of us. Once again, you can get me at hpickett@eaglecarehealth.com, or just go out to the website, eaglecarehealth.com. And I promise, if you put in a request to be contacted, I'll reach out to you. Thanks each and every one of you for being with us today. We hope we have helped you learn better how to control your cost. We'll catch you on our next broadcast. Everyone have a super blessed day. We are out of here.